Okay, I think we're right. Welcome and good evening, everyone. My name is Khanh Nguyen, and I have been a community pharmacist for about 15 years. Thank you for tuning in tonight for my contribution to Glaucoma Week. I joined Glaucoma Australia last year during COVID, a year that most of us would probably like to forget. And I really hope that between you and your loved ones that you were and continue to be safe during these unprecedented times. Today I've been invited to speak about the safety of the COVID vaccination for someone who is living with glaucoma and the role of the pharmacist and how we can help you out. It's an informal discussion. I don't have any slides, so I'll do my best to answer any of your questions live. But before I do that, I would like to acknowledge that the Aboriginal people and Torres Strait Island people are the Indigenous people of Australia. I acknowledge and pay respect to the past and present traditional custodians and elders of the nation. I also recognise those whose ongoing effort to protect and promote Aboriginal and Torres Strait Island cultures will leave a lasting legacy for future elders and leaders. So, a little bit about myself. I studied at the University of Queensland and spent the earlier part of my career working in Brisbane, Queensland, and in the last 10 years I have been living and working in Melbourne, Victoria. So last year I was one of the healthcare professionals working on the front line in a community pharmacy. I'm also currently working in education in Queensland, and my areas of interest are in mental health, eye health, pharmacy education and integrative pharmacy. So it's a very different time this year to what we saw last year, as we see the first COVID vaccine being administered last month. And I know that, as if you don't already know, every Australian is actually eligible for this vaccination as they gradually roll it out in each state or territory. Some of my peers and colleagues who work in the health industry have actually already received their first of 2 doses, and both of these doses are going to be fully subsidised by the Australian government. Now, to find out when you'll be eligible for yours, I highly recommend that you actually have a look at the Department of Health website and have a look at their COVID eligibility checker. It's a very simple tool. I actually used it just the other day, where you just pop in a few of your details, answer a few simple questions, and then it actually tells you just a rough idea of when you'll be eligible for yours. You can actually do yourself and do it on behalf of someone else, and then find out when you're actually going to be eligible in your state or territory. So when you actually find out when you're eligible, where will you be able to get the vaccine? So as mentioned, the process will roll out in stages according to your state or territory. And besides going to the GP, the other immunisers that are allowed to give it are the nurse and pharmacist immunisers. And I also wanted to reassure you that before these health professionals are actually able to administer the COVID vaccine, they have to undergo a compulsory training in order to be able to go through with the whole process. It's actually quite an extensive training, so rest assured your health professional will be very informed about the COVID vaccine when you're ready to receive yours. So from a community pharmacy perspective, if you've had a vaccination for the flu at your local pharmacy, the process will be very similar. So when you arrive at your pharmacy at the allocated time, you'll probably be asked to complete a pre-questionnaire and consent form, and it'll ask you details such as your personal details, your Medicare card, it'll check your allergies, medical conditions, any medicines you might take, whether you're pregnant or not, and it'll ask whether you're feeling well. So then it's then a requirement of the health professional who's going to give you the vaccine to then check the Australian Immunisation Register before they actually administer it to you. Now, if you're not already aware, this is actually an electronic record of any of the vaccines that you may have received in the past. And if you're wondering how you can access this, you can actually download it on the MyGov app, and it will all be listed. So when you're actually at the pharmacy getting your vaccine, I would suggest using this one-on-one time with your pharmacist to discuss any concerns or questions. The vaccine itself is an intramuscular injection, which means it's going to be given in your upper deltoid, in your upper arm. So it means that you may experience redness or pain after getting the vaccine. Your pharmacist will then ask you to stay behind for observation for about 15 minutes, and then all going well, you'll actually be issued with a COVID certificate or record as evidence that you've actually had the vaccination. But like I said, this will actually also be on the Australian Immunisation Register for you to view. I'll also mention that if you are intending to receive the flu vaccination, it is recommended to have the COVID and flu vaccines 2 weeks apart. And if in doubt, just check with your GP or your pharmacist, and they'll be able to advise you. Now, as many of you may be aware, the vaccination is new, and in Australia we have been supplied with the Pfizer and AstraZeneca COVID vaccines. The Pfizer vaccine is suitable for anyone over the age of 16, and the AstraZeneca vaccine is suitable for anyone over the age of 18. Now, both of these vaccinations are not contraindicated in glaucoma, so it is safe to say that if you get the COVID vaccine and you have glaucoma, there shouldn't be any issues. But having said that, it is still in the early stages, so obviously the benefits are going to outweigh any risks, and we need to use this time to actually report any side effects to the drug companies. Obviously speak to your GP or a pharmacist, because the more data we receive, the more we can actually improve the vaccine for future seasons. Also, because of the recent release, it's not likely that there are any conclusive studies in this area. Now, during the lockdown period last year in Victoria, it wasn't all bad, as we saw the advance of some services such as telehealth. So there was no longer any face-to-face contact. It was phone consults or online consults with your GP. And these services are probably here to stay. But we also saw the advance of things like electronic prescriptions as well. I know that a lot of my patients had trouble getting appointments with the prescribing eye doctors or GPs, optometrists, particularly in the early stages while telehealth was being rolled out. And then, there were just simply some patients who were really fearful of being in the community due to the high transmission rate. So then I know a lot of them actually admitted to me that they didn't use their eye drops for about days or even weeks. And we know that you actually run the risk of your eye pressure increasing or fluctuating, and obviously causing irreversible blindness if you actually go without your eye drops. So it's really important to actually try and use them at the prescribed times every day. I'll also just remind you that if you set an alarm on your phone or a device, there's also lots of apps now that you can use, or just maybe pop your eye drops somewhere that you're really unlikely to forget. Now, if you're a little bit late using your eye drops that day, it's still better to use them than to go without. And if you haven't already explored the Glaucoma Australia website, I strongly recommend that you do. They've got a really helpful section on how to manage your eye drops, and of course, speak to your local pharmacist as well. So our role as community pharmacists is to ensure that patients are educated not just about conditions like COVID, but also to ensure that you're on top of your coexisting medical conditions such as glaucoma. We have to remember that there are new medical conditions being diagnosed every day. So if you can manage your medication, it's actually still going to be better just for your overall health and well-being. So have you ever been in a situation where you've run out of your prescriptions, you've run out of your drops, you can't get an appointment with your GP or prescribing doctor? because if you have, I just wanted to let you know that if you actually pop down to your local pharmacy, most of the time, and more often than not, your pharmacist will be able to help you with a supply. So if you bring in the box or the packaging, it will certainly assist with this process. And depending on the state or territory that you live in, most of the time we can give you 1 month's supply just to get you through until your next appointment. But of course, seeing your eye specialist or your GP is going to be the best thing, just so that you actually get a thorough consultation. And I wanted to actually inform everyone that the optometrist is also a very valuable resource. They're always a wealth of knowledge, and if they have a scheduled medications endorsement, they are also allowed to prescribe eye drops. Okay, so that's pretty much all I wanted to discuss. So I've actually got a few questions that I've been asked just during my time in the pharmacy, and I thought I would just go through them here. So they're just frequently asked questions. So my first question was, if you are pregnant and you also happen to live with glaucoma, is the vaccine, the COVID vaccine, safe? And the answer to that is, it is not actually advised that you get the COVID vaccination if you're pregnant. There aren't actually any conclusive studies, and although they have actually not indicated that there are any risks, it is best to speak with your GP or pharmacist to actually discuss other options. So another one relating to that is, if you are breastfeeding and you happen to live with glaucoma, is the COVID vaccine recommended? And in this instance, it is actually advised, but they actually recommend that you monitor for any side effects within yourself and also your newborn. I thought this one was a really good question. The question is, on the day of the COVID vaccine, is it still safe to use your glaucoma eye drops or other medications? The answer is absolutely yes. It's recommended that you still continue to use any other medications prescribed at the usual times, and there are no potential drug interactions between the COVID vaccine or your glaucoma eye drop medication. So further on to that, if you happen to be initiating some new glaucoma eye drops and you get the COVID vaccine around the same time, obviously it's going to be really difficult to distinguish which one caused the side effects. So I would suggest organising a follow-up consult with your prescribing doctor to follow up with your eye drops. But it's a good idea just to keep any notes or a diary of how you're feeling, so then you can report everything back to your doctor. Another question is, can the vaccine increase glaucoma? So at this stage, it's unknown if it does, but it is unlikely to, as glaucoma, as you know, is an eye pressure condition, and COVID is more a respiratory condition. So it's unlikely that there is any direct or indirect links at this stage. And the last question I've got is, are there any eye-related side effects of the vaccine? Again, it is unknown, but if you feel any different, it is advised that you speak to your GP or pharmacist. Now, I'm just going to have a look and see if there are any questions that have come through live. Okay, so one of the questions is, when getting my vaccine, how should I let my pharmacist or GP know that I use glaucoma eye drops? What about steroid eye drops? So when getting your COVID vaccine, when you actually fill out the pre-questionnaire form at the pharmacy, there will be a section to add any other eye drops to that list, and they will be able to assess whether getting the vaccine is suitable. But like I said before, there shouldn't be a problem. And if you're at the GP, if you go to your normal GP, they should have a list of everything that you take. Otherwise, they also do have access to your electronic record. Just, if you go to different GPs and you have given consent, they can actually view everything that you take. What about steroid eye drops? So the answer to that is yes. Steroid eye drops you can obviously still continue to use as well when you get the COVID vaccine. Just with steroid eye drops though, unless your eye specialist or prescribing doctor has prescribed them permanently, it should always be reviewed. It's not something that we normally suggest that you use every day without medical monitoring. Okay, so next question. To be safe, should I get my eye pressure checked after the dose of the vaccination? Well, it's probably not a bad idea. I think that's a great idea. And usually if you're over the age of 50, they advise that you do get your eyes checked every 2 years. And then having said that, if you actually have anyone in the family that has glaucoma, getting checked more frequently is what is advised. So if you've got a history, then it's probably not a bad idea to do that. Next question. I am very sensitive to the ingredients in most glaucoma eye drops. Should I be worried about allergies or side effects of the COVID vaccine? Okay, so I think that's a really good question too, because I know that there are a lot of people that have a lot of sensitivities with their eyes, and in that case, I would just be aware, and if you use other drops or you use medications to actually manage those allergies, I would certainly be keeping them on hand. But of course, I would certainly be discussing it with your GP and pharmacist. Oh, quite a few questions. So during the clinical trials for COVID vaccine, did they test for side effects to the eyes? So I think I sort of brushed on this before. There hasn't been any conclusive studies to do with eye-related side effects. So it's something that I think we need to be aware of. So perhaps this time next year they'll report of some, but at this stage, no. Okay. So yes. So overall, if you are living with glaucoma, yes, your glaucoma eye drops still can be used, and yes, it is safe to get the COVID vaccine. Okay. Maybe I'll take one more question, but otherwise, if nothing else comes through, you're welcome to leave any comments and we can get back to you another time. So a little summary about what I've discussed with you tonight. I've introduced some information about the Pfizer and the AstraZeneca vaccines and their safety profiles for someone living with glaucoma. It's obviously very safe at this stage and it's recommended. I've also gone through who can give you the vaccination, so your GP, nurse and pharmacist immunisers. Where you can get your COVID vaccine, so you can go to the GP, you can go to a nurse or a pharmacy. And also I've gone through the process of what happens when you go to the pharmacy for your vaccination, and also how your pharmacist can assist overall with your medication management. Alright, so I come to the end of my presentation. Thanks for your time. I really appreciate that you listened, and I hope that you took something away or can assist somebody else. I don't know about you, but I'm really looking forward to being able to travel again and just to live a new normal life. Obviously exercising caution, but besides the COVID vaccine, as important that is, we still need to remember to social distance. If you can't social distance, wear a mask, sanitize and wash your hands. And also, if you've got even the mildest of symptoms, just get tested. So I hope you've all enjoyed Glaucoma Week. There's been some excellent topics this week. Stay up to date with anything that Glaucoma Australia is doing. They're a wonderful organisation and I really enjoy doing work with them. Register your email and also navigate their website regularly, because this is where you're going to find the most accurate and latest information. Thanks everyone. Enjoy the rest of your night.